Hello and welcome to this edition of the Preceptor Pulse. Today we're going to be talking about POwER precepting, organizing your precepting time and tasks. I'm Drew Keister, a family physician and educator, and let's go ahead and get started. The image here is of a beautifully organized workspace. Some of you might share some of my obsessive compulsive tendencies, and you might like to have your desks very organized and perfectly in line. Of course, the reality is my desk is never quite as organized as this, and I think that's probably true for many of you as well. It's just how life happens, and the same thing's true of precepting sessions. It's not always quite as organized as we'd like it to be.
As a preceptor, you have a bunch of tasks that are pulling you in different directions. There may be distractions in your environment, whether from the flow of patients and staff, or also residents and other learners, but also your email in basket, your EHR in basket. You're working often with 3 or 4 residents at a time, and somewhere in there, you want to find time to teach and to evaluate, which these days we're identifying needs even more focus on direct observation when we can make the time to do it. So, how do you do that? How do you organize your time and do all of this efficiently so that you're making it all work in the session? I'm going to be going over a model called POwER precepting that'll help us remember some of the steps to do that. So POwER is actually a mnemonic that stands for, I'm going to go through the first several of them here. First, prepare. So the hard thing for us here is that we really need to be thinking at the beginning of the session and at least a few minutes before a clinical session starts about how the session is going to go. Arriving early, making sure your learners are arriving early, reviewing schedules, touching base with the staff, potentially doing a huddle with the team, having the residents huddle with their clinical staff to go over some of the pieces. And it can even be helpful for you to do a little bit of chart stalking ahead of time, although you want to be careful not to overdo that. Oftentimes, residents who are doing pre-work in the charts will be able to tell you, or they may have relationships with people and know from their schedules where there might be patients who might give them trouble, patients who might have a lot going on, patients for whom they need specific pieces of information. And so that preparation phase is so important. One of the things that's not listed here is also checking in with with residents about what are their learning goals. What is it that they want to get out of today's session? Because it's going to be so much more educational for them if it's not just about surviving, making it to till the end, but if they have an educational intent into the session. The second part of POwER precepting is orchestration. So actually maximizing the use of your knowledge and experience, anticipating needs. And again, a piece of that is knowing where some of those landmine patient visits might be for residents and monitor flow. It's been a while since I've seen resident X. What's going on with them? Maybe I need to check in with their staff. Maybe I need to be knocking on a door and walking in the room. Making sure that, again, that the team is functioning, the residents are interacting well with their staff members, and that the conversations that need to happen there. And the other thing is not just sitting passively, right? Being up, walking around the clinical space, and that way checking in with everybody who's there to make sure there's not some sort of a crisis that's happening without you knowing about it. So those are the first two pieces of POwER precepting: preparing and orchestrating. I do want to give a shout out to Dr. Lilich and the team that published this initially. The references for that are on the last slide, and they'll be on the next one as well. One thing that I have added to my thinking about POwER precepting that they didn't have in their paper is this little W. They did have the little W. They were like, well, we don't really have a letter to fit there. So they just kind of left it out. But for me, I really like to think of the little w as the other work that we bring with us to the session. It's small, right? So it's intended, the reason that that letter is small is it's intended to remind us that's not the main thing we're there for. And depending on the number of residents, the independence of the residents, everything else that's going on, you often will have time to do other work during the session. So I think it's helpful to remember that and to, as a part of your thinking about POwER precepting, knowing, yes, it is not my primary intent, but it is something that I may be able to do during the session. And the most important thing is that I don't let it occupy me too fully, so that I'm not available in the way that I need to be to orchestrate the session as it flows. Here's the rest of that table one from Dr. Lilich's and et al.'s article. The next piece of POwER precepting is educating. So of course, that's why we're there. We're there to enhance the learning during the session and to do our best where we can to increase the evidence-informed practice that's going on in the patient session that we are supervising. We do recommend using microskills if you're not familiar with the microskills. At Preceptor Pulse, we've done another video about that, so take a look at those. I do have the reference for that microskills on one of the future slides here as well, in case you want to look at the original article. Um, but also, as a part of our education, we want to be helping residents to articulate clinical questions as they arise for them and using point of care information. We want to be helping them to do those lit searches and all of those pieces. And also to think about how does this translate into quality improvement projects that are already happening in the practice? Or potentially, if we're finding a problem within the practice, how could this translate into a future project that a resident might participate in or even lead? And then the last piece of POwER precepting, the R, is for review. The idea here is that we want to be giving the learners feedback as we go. We want to be checking out and finding problems early, providing appropriate information for patient care and also for the residents in their educational journey. We want to help them as we're going. So we're reviewing their care. When possible, we want to use the time when we're precepting to review notes. We want to encourage residents to finish their clinical documentation during the session. And we want to use some of that little W work time to actually be reviewing their notes so that we can give them immediate feedback if there's anything that they might have forgotten in their clinical documentation. And then also at the end of the session, making sure that you spend time reviewing how things went with each resident. We do have at Preceptor Pulse some other videos about how to give feedback, so you can take a look there at what you might want to include in those feedback sessions. But I think what's very important is to make a habit of doing that every time. This is from Dr. Lilich's article about actions that we need to do to facilitate active precepting and the POwER precepting in our learning sessions. One of the things that we're doing is right here, obtaining your commitment to arrive early for the sessions. And also, a part of that is making sure that the residents are committing to that. So if that's not happening, making sure that you're talking to the residents, talking to the program director, documenting the fact that they're showing up late in case it's a part of a larger professionalism issue that needs to be addressed by the program. Uh, Developing a notification systems, if you're not going to be in the area, some way of indicating that can be really helpful to help because we don't want the residents having to spend a lot of time wandering around the clinic space looking for you. Instituting huddles, we already talked about to some degree. Reviewing the microskills, again, another video on Preceptor Pulse that you can watch for those, and the link to that, or the reference to that article is there below, and the conference is at the end to wrap up and give feedback. All so important. So make sure that those are things that if they're not happening at your program, you're thinking about, making sure you're doing your part, and then talking with specific learners if there is a problem with individuals, or with the program overall if there's something that is consistently not happening as a culture of your program. Takeaways from this video, I want you to remember that mnemonic, POwER. We want to prepare, we want to orchestrate, We want to have that little W work, the things that we can do in between the other steps, but remembering that we're mostly there for the education. That's the E. And we want to review at the end of the session and as we go through the session to make sure that residents are getting as much out of this as possible. We want to set the expectations for ourselves and our learners so that they expect us to be power precepting. And also, of course, accept feedback, take feedback from yourself, and accept feedback from others within your program and elsewhere about how this is working and make a change as you need to.
If you'd like to contact me to talk about anything related to the Preceptor Pulse or about power precepting, my email address is drew.keister@jefferson.edu. I would always love to hear from you. And thanks for listening to this episode of the Preceptor Pulse.